Hello viewers, I'm Dr. Srinivas Jakka. I'm working as a consultant in Pediatrics, Pulmonology and Allergy at Ankura Hospitals, Hyderabad. Hello friends, let us now discuss about anaphylactic reactions. Anaphylactic reactions are the most severe of allergic reactions. Let us discuss what are the common triggers, how do we diagnose an anaphylactic reaction, and how do we treat it. Anaphylactic reactions, as we discussed, are the most severe form of allergic reactions that can affect your cardiovascular system or your respiratory system. So, if your cardiovascular system is affected, it can cause a drop in your blood pressure. If your respiratory system is involved, it can cause tightening of your either upper airways or lower airways. So, what are the symptoms? Say, for example, if your cardiovascular system is affected and your blood pressure comes down, your child may become drowsy or unconscious. You may find that the pulses are very feeble and the hands and feet can become cold and clammy. If the respiratory system is involved, there may be choking if the upper airway is involved, or breathlessness and wheezing if your lower airways are involved. So, what are the common triggers? The common triggers can be foods. For example, the common foods are nuts as well as seafood. It can be drugs. Say, for example, if your child is allergic to any medicine and it's not recognized and given repeatedly, it can cause a severe allergic reaction. So the common triggers across the world are usually drugs and foods. And how do we recognize? We already discussed. So the next is, how do we treat anaphylactic reactions? The drug of choice is adrenaline or epinephrine. So it's very important that this adrenaline drug is given as soon as the anaphylaxis is suspected, because when given early, it can be life-saving. But if delayed, anaphylaxis can cause severe consequences. So if you suspect anaphylactic reactions, take your child immediately to your nearest hospital. The doctor will give you the adrenaline injection intramuscularly into the thigh, and this can be life-saving. Once the child recovers, you should see your allergy specialist, who may be able to identify the possible cause of these anaphylactic reactions. He may also advise you to keep this adrenaline injection at home in case your child might have further reactions in the future. Thank you. For authentic health information, please subscribe to Health9. Thank you.